This is an experiment. I'm a scientist, I'm an organic chemist. We do experiments in labs. This is an experiment, testing what programs work most effectively. The academics here, Oxford academics working in collaboration with South African academics, particularly from the University of Cape Town, are providing that evidence which can then feed into policy making in South Africa and beyond.
Well, we're trying to do what's possibly brilliant or possibly crazy. We're trying to stop child abuse and create a free evidence-based child abuse prevention program for the developing world.
And then nomntana ungamshawuti uthethele soft nomntana ezantsi xa unomsindo ulumkise nabantwana into zibungozi yaqona into ezifana drugs abantwaneni nasekuhlaleni nabanye abantwana bazama bavulumkisa.
Children who have been abused are more likely to engage in sexual risk behaviours, which of course put them at risk for sexually transmitted infections, including HIV, for teen pregnancies and so on. They're also more likely to engage in alcohol and other drug use, partly to medicate their symptoms of anxiety and depression. And so we get a whole nexus of ills that really prevent children from succeeding in life.
We started off this program working with the World Health Organization and UNICEF and the South African government, and found these parenting programs could really work, but that no one had tested them in these kinds of contexts.
The researchers are in a way observing the intervention to test whether it works. Once that research has been completed, there will be a sufficient evidence base for the scale up of the intervention, the program, in South Africa.
So the whole program is based on very rigorous 30 years of evidence building in high-income countries, and on cognitive, behavioural and social learning theories.
So we have all our research assistants who are local people, mostly from the township or the villages around, who are Xhosa speaking, and they receive a lot of training on how to talk to people about very difficult issues.
Our most basic first session is about praise, and families learn to praise each other every day for something. And what happens with that is you build up a kind of positive base, and on top of that positive base you can start talking about the more difficult issues. But these things are hard to talk about. They're hard to talk about for us, and they're harder to talk about in rural and traditional communities.
I went to Cape Town for a training on how to facilitate the program. And then after that, then we collaborated to start Sinovuyo team.
There are so many people at our university doing amazing work, and the Vice-Chancellor dancing with grannies in a community centre in the Eastern Cape is a real sign that the university's invested.
They, in the recent REF, were ranked the #1 social policy and intervention social work department in the UK. That's a pretty remarkable achievement, and it's one that you can then see absolutely clearly on the ground here, the importance of their work.
South Africa is a phenomenal country to work in. It's one of the leading in policy for the SADC countries, and so influencing policy in South Africa is going to influence policy in most of Southern Africa.
As a psychologist, this is a contribution I can make to nation building in South Africa, and that's a huge motivation for me.
Well, some people believe that because it's Africa, you don't need to have the best quality science, but we believe that families here deserve the best.